The following program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.
Welcome to another episode of Speaking with the Senator. I'm Senator Kevin Avard, representing District 12 here in New Hampshire. And today we're going to be talking about Medicaid. And so I invited Carolyn Virtue to come talk about, I forgot what your role is though. You're 30 years in the industry. So.
I own a company that does case management for one of the Medicaid waivers, the CFI waiver.
All right, so you're going to kind of guide us through what's going on, and I know that there's some changes, and there's an effort to hold back a certain portion of this Medicaid expansion.
Step 2, phase 2.
Okay, and so anyway, welcome to the show.
Thank you.
And,
Thank you for having me.
This isn't your first time on one of our TV shows, and you've been in this industry for 30 years.
Yep.
So what do you do?
We do case management for the Choices for Independence waiver under contract with, it's not contract actually, it's fee-for-service. So we're an enrolled provider.
Now, fee-for-service has been in direct conflict with managed care, is that correct?
No, they just decided to move away from a fee-for-service model and enter into a Medicaid managed care model.
And what does that mean to the public?
So that means that the managed care model, it was originally billed as a cost-saving measure. It has not resulted in cost savings. But they chose originally 3 companies. One of them left. There are 2 remaining. And those 2 companies manage the individual's access to care. So
there's a company that is contracted to manage your portfolio or your care, and fee-for-service was?
Where you would just consume care as ordered by your doctor, or, I mean,
it was individual care.
Yes.
And whereas now you're grouped into this block, or some call it a cookie cutter type of situation with managed care.
Yes.
That everybody is treated pretty much the same, whereas the individual care is under the fee-for-service was a little bit more personal.
Yes, that's how I see it. I mean, I'm sure the managed care companies would tell you they're more personal with their members. But
and the sales pitch for the managed care is that, well, we can save the state money.
That was the original sales pitch. Since that did not come to fruition, the current pitch is, well, we have better quality.
And there are 3, one left. So now there's bids.
2 left.
There's 2 left. Now there's a bidding process, and that goes before the executive council.
The contract, the 3 chosen bidders. The commissioner is saying he's going to choose 3 again. Those 3 contracts will be sent to the executive council, but there will be a lot more than 3 people bidding.
So the original plan for managed care was that we want to save the state some money. This is going to be an effective way to do it. And why hasn't that worked out so well as far as saving money, that goal?
Well, several years before we ever implemented managed care, there was a white paper done by Anthem. And what they said was that New Hampshire was already a lean, mean machine. We had not excessively increased provider rates. We did not have huge pockets of overutilization. And that paper at the time said there were little, if any, savings to be had. There are other states that have implemented managed care, and they've scaled everything back and saved the state money. We did not have those excesses in New Hampshire.
All right, so we're trying to make something even leaner by bringing in the managed care.
But you can't make it leaner and continue to take care of people in accordance with federal guidelines.
So for the public, what is managed care? What is Medicaid as a role? If people are not involved with Medicaid, what is it?
Medicaid is a federal and state partnership to fund care for indigent people. So you have to be below there are criteria, guidelines for each individual program.
So
130% of poverty level is.
I know of one individual who actually lives in one of the wards here in Nashua. She's 52 years old. She has Down syndrome, and she's denied a certain medication because she, at her age, I guess she's acting out a little bit, so she needs a particular medication to help her with her either anxiety or just acting out. And she was denied coverage. How is that possible if these are the very people that need to benefit from, say, the Medicaid program or Medicare? How is that possible? How do they fall through the cracks?
They're denying quite a bit, the managed care companies.
Is this the part of the cost saving?
Yes, because even if that denial is overturned eventually, that you can't retroactively take medication.
Right.
So one of the things that the managed care companies are saying is a lot of times it's an initial denial and we're just asking for information, and it eventually gets overturned before it goes to appeal.
So I have a drawer full of requests up at the Capitol. I'm asking you these just generic questions because I'm going somewhere with this.
Yeah.
I had one lady, she's from up in Gilmington.
Yes.
She contacted me and she said, Senator, I need your help. My grandson throws up for no reason. He's got a specific disease that his brain tells him to throw up, and it causes respiratory problems. And then she went down a list of things that's going on. And under the managed care, because they definitely meet the poverty line, they were denied.
Denied for what?
Denied a particular operation which is not around here. Nobody in the region takes care of this type of case. So there are 3 other places in the country that take care of this. One's in Michigan, one's in Texas, and I forgot where the other one was. And the one in Texas is a 3-year waiting period. The one in Michigan's 11 months. And so they were denied under this managed care. Can you help me? So I went to the commissioner or the department, and they said, oh, no, we can't talk about the case because of a privacy thing. So I had to go back to the mother. I had to have her, or the grandmother, to get the mother to give me a release form.
Yes.
So then that I could bring it before the commissioner or Centene, which was one of the managed cares. And they said, oh, well, we'll look into it. And then there was this whole appeal process that the people didn't even know about.
Yes, the individuals have a right to appeal any decision, and they should be notified of that right with the denial. The MCOs are required to notify the consumer with the denial.
I had to notify the individual. And then there was this back and forth. Now, this is a life-threatening situation. This is just another one. I got a few more. But when I brought this up, oh yeah, Senator, we're working on it. And then I hear from the constituent up north, no, they haven't told us that. And it was just back and forth. Who has to contact their senator in order to get coverage? Is what I was starting to mull in my mind. How bad is the system?
Well, the bigger question in my mind is what's happening to the individuals who don't even know their senator to contact.
Oh, this was a long back and forth.
There's a lot of denials that are just falling under the radar screen. People don't know that they have alternatives
and
or
the automatic
measures.
appeals. Now,
yeah.
there was a situation where we brought it up again about the appeals because of the new Medicaid. But there was another case where a woman brought her daughter to jail car. Are you familiar with jail car?
Yes.
Yeah. And not brought her daughter, but brought her case. Senators, my daughter cannot drink water. So in order for us to hydrate her, we have to buy a special box. It costs $35 for this box. And diapers because she's incontinent, or there's a whole host of reasons. And definitely met the guideline, poverty guideline. And she came before jail court and she said, why am I getting denied? I have to buy a powder. It's $35. I have to mix the water with the powder and feed my daughter that. And I can't get coverage for that. I can't even get coverage for the diapers. And we need help. Why have I fallen through the cracks? And then there was another one, and another one, and another one. And I'm thinking, what is going on here? Is this managed care failing the people?
I don't believe that the managed care system as it exists presently is serving the individuals or the state. I mean, we can definitely do better. And even with all of these denials, the rate cells that these companies are being paid for each member have climbed every year.
Rate cells, you mean the cost of care?
No. And that's what gets confusing, because when I say the rate cells, that's the per member per month amount that the state is paying for each member in accordance with the category that each individual is in.
Okay.
So the MCOs have gotten a raise every year, and
MCOs means?
the managed care organizations, the two companies, have gotten raises, multiple raises, at least 8 since they started providing care. I believe it's more than that. And there has not been additional care provided to the members or the citizens, nor have there been provider increases.
I went with one organization here in Nashville who's a provider, and they need a raise.
You're singing to the choir.
They need a raise, and it's hard for them to get good medical staff because they don't have the money. And I looked at them eyeball and I said, is it basically just the allocation of monies? Is that where the problem is going? They're not getting their allocation. They're scratching, clawing just to survive. And then I went on one of their home visits, and they really put a lot of time into this.
Yes.
And visiting nurses or I don't know if it was Harbor Homes that I went with. Or,
yeah, you have a lot of great companies in Nashua that are doing great work, and
they're
we've
starving for
put
funds.
a lot of additional money into Health and Human Services, and it's going to Boston and St. Louis, and that is just not the New Hampshire way. The CEO of Centene makes $23 million a year, $12,000 an hour. Their market is wholly paid with public funds.
And which can be very disturbing, obviously, because when they're, and it's not that we need to bring more money to the state, because it's just the allocation. Where is the money going? Where is it funneling? We put so much money towards this and this and this, and it gets siphoned off out of state. Why isn't it staying home with the providers?
Yeah.
That's what you're saying.
Yes.
Yeah. And I
Yeah.
saw it firsthand.
Yeah.
Nashville has a lot of needs for these types of services, more so than other areas in District 12. But I saw it firsthand. And it's not that the money's not there, it's just not going to the right spots.
Right.
I'm in plain English.
Right.
So.
And now we want the department wants to take a whole nother sector of the healthcare system, the long-term care sector, so the nursing facilities, the home care, and put that into managed care. And the department is just not prepared to do that. Senate Bill 553 stated that the department had to go back to the providers, hear their concerns. It delayed the implementation, and then come back with a new plan. They have not addressed any of the concerns that the providers raised during that process.
So you said Senate bill. Now I know there's a House bill that's coming our way with the
House bill that's for this year. Senate Bill 553 was a couple of years ago. It created a process.
Was that for the managed Phase 2?
Phase 2.
Yes,
It
I remember that.
delayed
Right.
Step 2.
Yeah, Step 2.
Yes, and all of the providers faithfully went to those meetings, participated, submitted reports. None of those recommendations are in the managed care plan that the department put forward.
So when I heard this bill, I heard testimony from folks that were in the room, and there's special needs. There are some needs of people that are in the DD wait list. There's or DD
Elderly and adult,
elderly
people in nursing facilities.
and this whole cookie cutter situation now has a really bad effect, because these are highly specific needs with care that is needed. Some
Yeah.
people need certain tubes, certain medications, certain people to handle, certain this, certain that, certain this. And if I understand correctly, we had this Medicaid to help the most needy. And in our state, these are the most vulnerable, these are the most needy, and yet they want to manage care of them into a cookie cutter situation to where, well, the odds of having to appeal are going to skyrocket because of the individual needs and them being denied. Am I off base on this?
Yeah, and
I
no,
am? Oh, okay.
no. And the other piece of it is, if you start denying payments to these providers in this system that are already on very shaky ground, as you pointed out,
Right.
we are going to start losing providers, and we already have unmet needs
Right.
in the system. So the department has not done their due diligence on this provider system. They do not understand that which they are charged with changing, and that's evidenced in the plan that they've put forth for this phase 2 population. They're going in the commissioner's plan. He intends to execute the contracts with the managed care organizations, and then go to the 2019 legislature to
All right. So
pass.
I may be a senator, but just dumb that down a little bit more for me. How's that
Okay.
going to work in effect?
I'll give you an example. So in current statute, it says that case management, the service that I provide, shall be provided to individuals in the community who meet nursing home level of care or in nursing facilities and want to transition home. The commissioner or the department wants to eliminate case management and have care management from the MCOs in the new contract. That's what the plan that the department has published states. So in order for him to do that, the case management statute needs to be repealed. So he's not going to do that before he contracts with the MCOs.
You need to legislate that repeal, don't you?
He's going to do it after the contracts are signed.
How is that possible? How can you do that?
Well, that's what I'm asking at the hearing. I went to the public hearing and I asked that question.
And how did they respond?
They didn't.
Okay.
So they didn't answer a single question raised at the public hearing. And the public hearing on the implementation plan was very interesting. That was held at the Hazen Drive Auditorium a couple of Tuesday nights ago around this time, which is, as you know, not an easy time to,
No, it's not.
get people out. And I would say there were probably 80 people there. 20 or so people spoke. Not a single person spoke in favor of the plan that the department has put forward.
So Neil Kirk has a bill on managed care on phase 2.
Yes, he does.
So
He was there.
did he raise concerns?
Yes, he did.
And were his questions answered?
No, they said, thank you, Representative
That's
Kirk.
not a good thing to do. Not with Neil Kirk.
No,
No.
no, they didn't, there were no responses given.
So his bill, if
1816.
1816, if we pass that, that will definitely help out the,
If the Senate passes House Bill 1816 as written, long-term care, so step 2, will not go into managed care, removes the authority.
okay. And is there a fiscal analysis with that? Is there an impact of some sort?
I did not see the fiscal note
Okay.
on the bill. Even the department is not claiming this is going to save money. There will be an increased cost, just like there was with phase 1. There are less savings to be had in phase 2 than there were in phase 1.
And I understand that. And my worry is more people that are truly dependent, that really have are the most needy, in my humble opinion, are going to suffer.
Well, and that is a very important point, Kevin, because a lot of times with the elderly and adult population, the deafening silence from those recipients is interpreted as consent. It is not consent. It is a population with no voice.
And we've
These
seen, yeah.
people's plates are so full. So I'll give you an example of an individual that I myself serve and provide the case management to. She's my age. She lives alone. And she cannot transfer in and out of bed, in the bathroom. She needs assistance. So when you wake up and the only way you're getting out of bed if somebody comes to help you, that needs to be your priority for the day. And if the expectation is that she's going to have this roaring voice and show up to the department, you know, I mean, she definitely has a voice. But these beneficiaries, these consumers, their plates are full. And a lot of times their husbands, wives, mothers, brothers, daughters are taking care, are involved in the care, because it, you know, it takes a village. These recipients are nursing home level of care, and we have them in the community.
Which is cheaper on the community.
Yes.
If they're at home and not in the nursing home.
And we don't have the beds.
No.
Our nursing home beds are full.
And
So-
not to add more weight to the problem, but our population is aging exponentially.
Yes.
So the solution is to pass Neil Kirk's bill at this point and at least throw a lifeline to this community for certain.
Oh, Neil Kirk's bill, if it's not amended, it saves the population, period. Neil Kirk's bill gets the job done.
And I'm glad it's out there. Some people have approached me on it already, and I've been on this page for a couple of years
Yes.
now, and I've listened, and I don't like seeing people fall through the cracks, and we need to address this. I'm running out of time. I know it goes quick. Is there any final thoughts that that the public needs to know?
There's one last thought that the department is doing. They, in their plan, are having care/case management. The federal government and the state of New Hampshire define those as two separate and distinct functions. Case management is a medical service that is provided to an individual for the individual, directed by the individual to access the care in a person-centered manner for the individual. Care management is an administrative and financial function of an insurance company or an MCO. They are not interchangeable terms. It is not a medical service delivered to a consumer. It is sometimes delivered by medical professionals, but it's delivered to shore up the bottom line of the MCO. So those are two separate and distinct functions, and there is no such thing as care versus case management.
How do people get in contact with you?
848-7345.
Is there an email?
Carolyn at granitecm.us.
Thank you for coming on the show. Thank you for watching Speaking with the Senator. We're going to have Carolyn back in the future to talk about more ramifications to Medicaid. We want you to understand that these are issues that are affecting individuals that really can't help themselves. And we want to make sure that they're taken care of, and that the system that we have already in place that is set out to take care of these individuals will take care of them. And so there are efforts to do that, but we wanted to bring this to you so that you understand some of the gears that we're working with. And so next week we'll have Carolyn back to talk about some of these issues. So thanks for watching Speaking with the Senator.
The preceding program was provided by an independent producer solely responsible for its content. The opinions expressed do not necessarily represent the views of this station, its staff, board of directors, or underwriters.